Hi family, how are you? I'm running a little bit behind today. I'm sorry about that. Come on and join in. We are looking forward to seeing you today. We're going to talk a little bit about hospital stay. This is Advocacy in Action, Navigating the Healthcare System. Thank you so much for joining the group, for joining Taking Care of Us, and for joining me today as we go live. My name is Carmen Wimberly Cawthon. I am or have been a caregiver for a long, long time. How did I get here? I lost a child to violence. I was diagnosed with a rare disease. I was on oxygen 24/7, and I was caring, hey Diane, for a sick child and a husband, and working full time. I made the decision to come home from work for 6 months, and I never returned. Because of that, I was able to take care of my elderly parents. I began to travel around the world and start a business using skills that I had developed. Now I confidently speak up about race, equity in the community daily, and I hang out with people who have a global reach and are changing the world. Today, on Tuesday, we stopped after talking about what happens when you move from the ER to a hospital room. And today I want to talk a little bit about your hospital stay and some of the things that can occur during that period of time. If you have any comments or questions, please put them in the comment box. If you have questions, I'll try to answer them as I see them. If not, and you find some other things that you want to, I think I'm going to put up a post today to see if there are other things that you all want to talk about this hospital experience. So, when you're in the hospital room, after you've been taken to a room, the nurse has checked you in. The process is quite a bit like what went on in the ER. It's just a lot quieter because you're in a separate space. So there's a morning routine. Normally the nurse shift changes at 7 in the morning, and then there would be another shift change at 7 at night. There may be a group of nurses coming in around 3. But at 7 o'clock, the nurse who was on at night will talk to her relief nurse at the nursing station about the patients that they were in charge of. Sorry for saying she, because there are quite a few male nurses these days. And they'll bring them up to speed on what occurred with the patients that they were responsible for overnight. Quite often they will bring the relief nurse to the room. In fact, I think they do that most of the time. And shortly after the nurses have handed over completely, the relief nurse or the day nurse will come in and check vitals for their own record. So there's a consistent record of vital signs and activity for a patient. If you're seeing a specialist or if you're seeing the hospitalist, normally you'll see a specialist in the morning. Sometimes they will come in. They may not come in your room. They may check to see what's in the record, and they may order tests to be done before they come in to see you, so that they will have the results of the tests to help them assess what needs to be done during your stay. And it could be that you had tests one day, and those tests indicated that something else needed to happen, so there may be a requisition for more testing. We won't get into specifics about different types of testing, because for every different situation there are different types of testing. So if you need information about specific tests, please put that information in the chat, or start a post in taking care of us that ask for information, and we'll work on that. Testing and getting the results take time. Excuse me. Um, some tests, are blood tests. Some tests, they have to take you somewhere else, MRI, CAT scan, x-rays. There are other tests that can be done outside of the room as well. Generally, for some things they'll wheel the whole bed out. Sometimes if you're able, they'll put you in a wheelchair and wheel you out. It just depends. If you're in a specialty area, like the ICU, which is intensive care, or CCU, critical care, things are a little bit differently, and we'll talk about that a little bit more, I think, on Tuesday. Generally, if you're in CCU or ICU, you can't get out of bed to go for a test. A lot of times they'll bring mobile equipment to you. And a lot of times you're in such a condition that you just have to stay in the, they're doing immediate things to make sure that you still live. So they're trying to take care of things that are at hand. You may be on a breathing machine or a ventilator. That can't be removed. And the nursing situation is completely different when you're in ICU or CCU. Generally, the rooms are right around the nursing station with a glass door so the nurses can, and there's an observation room, so there's an area where they are observing all of the monitors. Somebody is observing them on a 24/7 basis, and they are and they can visually see you in the area, and so a nurse will not necessarily be responsible for as many patients in the ICU or CCU situation as they are on a regular floor. So we'll talk about that a little bit more later. That can be a little more scary if you're a family member. You can rarely, sometimes you can stay in the room the whole while. But generally there is a separate waiting area for those family members. And a lot of times you're only allowed visitors like once for like 5 to 10 minutes every hour or every 2 to 3 hours, just depending on the severity of the case. I have been in places where, or in situations where the family was allowed to stay in the room the entire time, and to help minister to the patient. But quite often that is not the case, and so you have to be prepared for that. We'll talk a little bit more about specialty areas like ICU and CCU on Tuesday. Some of the other things that are part of the process when you're in a hospital room, there may be therapy ordered for you, different types of therapy. There may be breathing therapy. You may have to have asthmatic treatments. You might have to be hooked up to a machine, and they put medicine in the machine, and they put a mask over your face, and you have to breathe that to help open up your airways. There may be physical therapy ordered for you. And someone from physical therapy will come and work with you, whether that's helping you to get out of the bed or learn how to do that, helping you to walk. There may be therapy required where you have to go to a water therapy process. So there are lots of different types of therapies, and the doctors will order that. Sometimes they will come in and tell you what they're ordering. Sometimes they leave it to the nurse staff to come and tell you. The tests that are ordered, once the doctors have assessed test results, they give direction for your treatment. They will discuss that with you. That might take one day, that may take several days, depending on what occurs. specialists. If a specialist has been called in, they will also be in consultation with the hospitalist that we talked about on Tuesday. That means that you'll be seeing more than one doctor if there's a specialist called in. Sometimes the specialist comes in, assesses you, orders treatment, and they've done what they need to do, and they may discharge you just back to the hospitalist, so you may not see the specialist again. If this is a really important point. If a doctor comes in to see you and you aren't comfortable seeing them on your own, you want somebody else, if you're the patient and you want somebody else to hear what the doctor is saying, you can always ask the doctor to call whoever your caregiver is if they are not present in the room. I have done that several times. I've left instructions at the nursing station. If, say if I've been at the hospital most of the night and I go home, I have left instructions to ask the nurse, to ask the doctor when they come in to get my phone number. I'll leave my phone number, or they'll put my phone number on the board that's on the wall in the room, and ask them to call me, because sometimes the doctor will come in early in the morning. If you've been there till 3 or 4 o'clock and you need to go home and get some rest, you still want to know what the doctor has to say. And sometimes, so in the case where you have an elderly patient who has dementia or doesn't necessarily understand things and may not question or ask questions about what's going to be done, or is not in a state where they can, if they're sedated, then they don't know what the doctor is talking about, because they don't really hear it. So feel free to do that. That is your right as a caregiver. That is your right as a patient, to have someone else to hear what the doctor is saying to you. And it's important too, because when you're sick, and if you are sick enough to be in the hospital, you probably don't really want to be bothered trying to figure out what the doctor's telling you. So it's important for somebody else to hear what is being said. And that notebook that we talked about several days ago, it's important for you to write that information down, and to write down any questions you have, so that you can ask and feel competent, feel like you have some understanding of what's going on. So I wanted to tell you that's really important. Sometimes you have to wait in the hospital for results of a test, and they aren't necessarily doing any more treatment right that minute. You may be getting your medications, but they aren't necessarily doing anything else. So I remember there was one point where my mother had an MRI, and she decided she wanted to leave the hospital. And so she checked herself out against medical advice. So AMA, if you're determined to leave the hospital and they consider that you are competent, you can check yourself out against medical advice. I don't advise doing that, because you want to find out the results of whatever you went in for. But it turned out that the test that Mama had, as long as she was in the hospital, there was an urgency to get the report done. When she left the hospital, that urgency ended because she made the choice to leave. So you need to weigh your decisions. It's very important to weigh those decisions. If I'm speeding up today because I'm sitting outside. With this, I'm not comfortable. I told you all last Thursday, I'm not comfortable with my child catching the bus going to work, so I brought her to work today. If as everything flows through the process, if the doctor feels that they've done all that they need to do, or they've done all that they can do, and it's time for you to leave, and sometimes they leave, you need to leave because the hospital is not the best place to be if you're well or if you're getting better. The hospital is full of germs because it's full of sick people. It's not necessarily a bad thing, but you don't want your hospital stay to be any longer than it has to. So the doctor may determine that it's time for you to be discharged. A discharge doesn't necessarily mean you're going home. It depends on what you and the doctor come up with. Um, if you're feeling better, the symptoms have been addressed, the doctor feels that you're well able to go, then they will order your discharge, and they will talk to you about what those options are. So you can go home, um, you can be discharged to rehab, you can be discharged to hospice. Uh, you those are all of those are options, and the doctor will talk to you about what those options are. So if the option for you is that you need to go to rehab, you need some more therapy, you're in between ready to go home, but they don't want you to go home, especially if you're going to be on your own. um, then they will try to find a rehab facility for you for further restoration and therapy before you go home. Or in some cases, that might be a permanent stay for you. It just depends. This is not, they don't make the decision and then they put you in an ambulance to send you right away. Um, it takes a little while. It may take a day or two. There are social workers at the hospital. The social workers will be called in to visit with you and determine what the best placement is based on what the doctor recommended. If the social worker comes in to talk to you and your caregiver is not there, or you, the caregiver, are not able to be there, the same applies. Have them to call you. It is important that everybody be on the same page. So when the social worker comes in, after the doctor has made the recommendation for what kind of therapy you need when you leave the hospital, um, you could be going to rehab, or it could be that you need therapy at home. The social worker will come in and make recommendations about who is best able to handle that. There are agencies that can come into your home. Um, some of those are based on what your insurance will cover or what your Medicare will cover. And sometimes it's based on some placement that you need. So in most states, and it took me a long time to understand this, and I worked at the legislature and I would hear conversations about certificate of need, but I didn't really understand what it was, and I had no need to ask when I was at work until my parents, I was caregiving them. Certificate of need, or CON, uh, specifically means that a facility is licensed or given a certificate for certain types of care. So every rehab facility, every nursing home is not licensed for the same kind of care. And that's so that you don't have pockets. You don't have pockets where everybody gets all the same kind of, everybody in that area can get all the care, and people in other areas in the state can't get any care. So, before a facility is licensed at all, they have to go before a board, and they request certain types of placement, and the state makes a determination of what types of care they can give, what need care that they can give. And so the social worker has all that kind of information and will know what facilities are licensed for what type of things. Sometimes you can find a facility or several facilities in the area where you live, but sometimes you can't. And so I've had relatives or friends of friends who've had relatives who were not able to be placed near where they lived, so they could not visit often. But there may have only been 2 or 3 places in the state that were licensed for that, or 2 or 3 places in a several county area that were licensed for that. And then they're licensed for a certain number of beds. So if they're licensed and they don't have any beds available, then you have to look for the next place that has a bed available for that particular type of license. That's what the social worker comes to talk to you about. And my suggestion is always that the caregiver, because once the social worker gives you the name of the facilities that are available, you don't want to just pick them. I mean, you don't want to just like, oh, well, that name sounds good. you want to know a little bit more information about the facilities. So my suggestion to you is that you take the names and you do your own research. Now we're going to talk about that some on Tuesday. We'll talk about the critical care and intensive care kinds of units in the hospital as well. But I think it's important for you to know that you can do your own research. You don't research. And I'll look for some, or I'll make a list and come up with places where I tell you I trust for you to get medical information online. Everything you read online is not true, and everything that you see online is not necessarily the best place to go get information from. So I will give you some of the places on Tuesday that I trust, that I go and do my research when I have a medical question or facility question. And if you know someone who is in the healthcare profession, that's always helpful to reach out to them to find out, what have you heard? If you have friends or family who have had family members in rehab or healthcare facilities, ask them for their recommendations. Ask them what things that they saw that they liked, what things that they saw that they didn't like, what things they had to deal with as issues, and what things that they thought were really, really good. It's important for you to have some personal knowledge as much as you can about wherever you or your care person that you're taking care of is going to go. And even with that, you still may, I mean, there are going to be some issues because they're human beings doing everything everywhere. But you want to have as much information as you can so you can make a well-informed decision about the person that you're taking care of. I want to tell you the hospital visits that I have had, the situations I've had to deal with. Personally, I have been with some family members on some other issues, but these are things that personally I've had to deal with. So in pediatrics, I had a child who has scoliosis. She had scoliosis surgery. She had rods put in her spine to straighten her back. And then she had issues several years after surgery, including severe staph infections. With adults, I've had dealt with strokes, high blood sugar or diabetes, fractures, nausea and vomiting, kidney infections, geriatric medication interactions that led to having to have psych evaluations, emergency eye surgeries, gout, kidney disease, AFib, which is a heart condition, congestive heart failure, MRSA, and gallbladder. So those are just things that I've had to deal with personally with family members, but there have been some others. I see a comment here from Diane, and I can't read all of it right now. So I will check on that, and we'll see what else we have that we can offer. We're still going live every Tuesday and Thursday at noon. I may start to do some short, unexpected lives as different things come up. And we may interview some folks who can help us with some of these, tackle some of these issues. Eventually, we're going to get out of healthcare and move to some other way of advocating for our families, for ourselves and our families. But that's what we have for today. I thank you so much for joining me, and I look forward to seeing you next Tuesday on Taking Care of Us, Advocacy in Action. Have a good day. Bye-bye.